Okay. Knock, knock. Hi, my name is Caitlin. I will be your nurse today. How are you feeling?
Great.
Good. So what I'm going to do is I'm going to assess your cardiac function. So I'm going to listen to your pulses, palpate your pulses, and look for any other signs or symptoms of cardiac dysfunction, okay? All right, so I'm going to close the curtain to provide privacy. I'm going to use hand sanitizer to wash my hands, and then I'm going to identify the patient. So can I have your name and date of birth, please?
Taylor Brobeck, 8503.
Okay, good. That is what I had, so that all matches. So what I'm going to do first is I'm going to assess your jugular vein. So if you could go ahead and lay on your back for me. And I would raise the head of the bed to a 45-degree angle and ask the patient to turn their head to the side. So can you please turn your head to the side? And I'm going to look for any pulsations on their neck associated with the jugular vein. And I do not see anything, so can you turn your head to the other side, please? Again, looking for any pulsations with the jugular vein. I do not see any, so I'm going to have you go ahead and sit back up for me, please. Okay. Now, I'm going to feel for the carotid pulses, so doing this one at a time to prevent any dizziness. Okay, now this other side. Okay, so what I'm going to do next is I'm going to listen for any bruits, so that it would be like a whooshing sound in through your artery. So using the bell of my stethoscope, again, I'm going to place that on the carotid one at a time. Okay, now we're going to place it on the other side. Okay, good. So now I'm going to be assessing your heart sounds. So I'm going to place my stethoscope on 5 different points on your chest, if that's okay with you. Okay, so first I am going to place the diaphragm of my stethoscope on your aortic valve. So that is like the second intercostal space on the right side. Okay, I'm going to move over to the pulmonic, which is the second intercostal space on the left side. Okay, moving on to Erb's point, so that is the third intercostal space, again on the left side. Okay, tricuspid valve is the fourth intercostal space on the left side. Okay, good. Now, to assess the apical pulse, I'm going to have you lay on your back and slightly to the left. And I'm going to assess about right here. So is it okay if I put my stethoscope under your shirt? And this is the fifth intercostal space on the left side. And this one I listen for 1 whole minute and count it. Now I will have you go ahead and sit back up. And the next part, all while I was doing the pulse, the heart rate, the heart sounds, I was looking at her upper arms for any blue discoloration, any pale ashiness, assessing the temperature, making sure they were pink and warm. Now I'm going to assess skin turgor. So I'm going to just pinch up some of your skin. I promise it won't hurt. So I'm just assessing to see if it goes back down. Going to do it on both arms in different locations. And her hands. Okay, good. Now I'm going to assess for edema. So I'm just going to push my finger into your skin. See how quickly it bounces back up to normal. Okay. Again, doing it on different locations all over her upper arms. I'm going to do capillary refill, so can I see your fingers, please? Okay, assessing to see how quickly her nails go back to her original color. Go ahead and do it on like 2 or 3 fingers. Okay, now I'm going to be palpating your pulses, so I'm just going to feel in 3 different locations. So I'm going to start with the radial pulse. Now I'm just feeling to see how bounding the pulses, how much I can feel them, making sure that they're normal, not diminished, not too hard, making sure the rhythm feels normal. Okay. Now I'm going to do the brachial pulse. Okay, moving on to her other arm, I'm going to go ahead and feel the ulnar pulse. And now the radial. Okay, and moving on to brachial. Okay, so I'm going to go ahead and move to your lower extremities. So once again, I'm going to look for skin color. Again, no blueness, no ashy grayness, anything that would indicate poor perfusion. I'm also going to feel for warmth, make sure that it is nice and warm, not too hot, not too cold. I'm going to also assess the hair distribution. And so everything looks good. I will now check for edema. So again, do this by pushing down my finger, seeing how quickly it returns back to normal. I'll do that on her leg. Okay, while her toes are up here, she has nail polish on, so it's going to be a little bit harder to assess the capillary refill. Preferably there would be no nail polish, but so we're just gonna pretend like there's no nail polish and everything looks good. And then I'll repeat that on the other leg. So again, check for edema. Okay, everything looks good. Now I'm gonna check for capillary refill. Everything looks good. And now I'm going to assess her pulses. So for the dorsal pedis, it's by the big toe, like in between the big toe and the second toe, go right on up into that space. Okay. Go right on up into that space. Same thing for like what I did at the upper extremities, assessing for like a bounding pulse, a diminished pulse. The dorsalis pedis is on this side, oh, not pedis, posterior tibialis. It's right on the back of her like ankle, right by the notch. Okay, I'll have you uncross your legs, and now I will check for the popliteal pulse. So that's just right behind her knee. Okay, and I'm going to repeat that on her other side. So the dorsalis pedis. Okay. Posterior tibialis. Okay, and then finally her popliteal. Okay. Before I leave, do you have any questions, comments, or concerns?
Nope.
Okay. Does any cardiac issues run in your family?
Nope.
Okay, good. If you do have any issues come up, please feel free to call us, and you can have a nice day.
Oh, gosh.